Doctors with disabilities exist in small but measurable numbers. How did they navigate their journey? What were the challenges? What are the benefits to patients and to their peers? What can we learn from their experiences? My name is Lisa Meeks, and I'm thrilled to bring you the Docs with Disabilities podcast. Join me as I interview docs, nurses, psychologists, OTs, PTs, pharmacists, dentists, and the list goes on. I'll also be interviewing the researchers and policymakers that ensure medicine remains an equal opportunity profession.
Hello, and welcome back to the Docs with Disabilities podcast. In today's episode, we are joined by Dr. Kruti Shah, a clinical operations pharmacist at Rush University Medical Center, who in her care of patients ensures safe and effective use of medications and provides collaborative drug therapy management. Being a woman of color and having a disability of hearing loss, she's a passionate advocate for disability, diversity, equity, and inclusion at Rush. She and Dr. Meeks discuss how her upbringing shaped her evolving perceptions of her own disability, the ways in which her formative experiences have informed her work advocating for patients, and her hopes to empower future generations of disabled communities. We begin with an introduction from Dr. Shah.
My name is Kruti Shah. I work as a clinical operations pharmacist at Rush University Medical Center based in Chicago. Culturally or background-wise, I consider myself Indo-Canadian American. It's a fancy way of saying that my life has spanned over 3 different countries. I was born in India. I was a teenager when my family immigrated to Canada, and then for pharmacy school and working relationship, I moved to the US. And in my family, I pretty much surrounded by STEM, social work. My mom was a social worker. My dad was an engineer. And then my younger sister is a dentist. My younger brother is in medicine. So I feel like we're all healthcare professional and somehow it's just in our blood. But one thing that my mom, who single-handedly raised us 3 kids because my dad passed away at a young age, was to live a life with courage, with dignity, and with confidence is something that I really cherish.
You have a fascinating background. So why don't you tell the audience about your disability and when it was discovered?
Yeah, thank you. That's a huge part of my identity now. So I was born in India and I was 3 years old when I was first diagnosed with mild to moderate hearing loss. And my life is kind of segmented in 3 different sections. So I'm talking about the first section, which is my upbringing in India. And my parents were concerned. It came as a shock for them because both of them are fully hearing. And so they were not satisfied with the first expert opinion. They went to a second ENT physician, a third one, and they're like, we need to know what we can do for our daughter. They wanted to really find answers. And because of the traditional model of disability at the time, this is 80s and this is India, even traditional values were intertwining with medicine. And so the physicians were actually recommending that because the hearing loss is mild to moderate, that your daughter can get by without wearing hearing aids. And that the implications of having hearing aids, visible hearing aids, will invite bullying, judgment, shame, and that it would have a negative impact on her personal, professional, or emotional growth. And so pretty much from that point onwards, I was told by the physician that the way to compensate for your hearing loss is focus. Focus when the teachers are speaking, lip read, come home, do your homework, even if it means you're doing everything all over again. So from 3 onwards, I felt like I had to learn to hide my disability, which I was effective at, but then I had to compensate and work hard. And I knew I was at a disadvantage at the time.
It strikes me as so interesting because at that age, you internalize all of that. You were taught shame really before you had an opportunity to perhaps, maybe not feel it from those external sources. You were told to hide this. they may have been trying to protect you in that, right? But think about our medical society and what we teach people about themselves through that sort of narrative. So you are using like your full cognitive load, right? You are during the day using every ounce of energy to focus because you can't hear everything. How did that impact you socially?
It was definitely difficult. I remember having to kind of position myself to the talker because I'm lip reading and I'm missing sounds if they're facing away from me. I remember being in a situation where somebody's like, "Oh, you didn't hear me? Haha, how funny." And I would just say, "I'm sorry, when I'm focused, I'm so zoned in." So I was kind of coming up with excuses to hide my disability. And that was, I felt embarrassed. I felt that it was on me. Like I felt like I was the one who was taking all the blame for being maybe a little weird or awkward in social interaction. And I'm the people who know me, I'm a very bubbly and a very an outgoing person. I love to learn about people. And so when a disability like this is putting me at a disadvantage where I can't even communicate, it was tough. I was not my full self.
Yes, I can endorse that you are a very outgoing, gregarious, fun person. But I can imagine that as I'm trying to think like, okay, like in middle school, if you're still trying to hide this, I mean, middle school just altogether, right? For girls, it's just the worst. But if you're trying
So,
to hide this, I imagine that you're not paying attention or you're joking might move to you're snotty, you're aloof, you're, a number of other things.
oh, 100%. I mean, a lot of times I felt like people have judged me as I'm rude or I'm
Mhm.
spacey or I don't have social manners or I'm weird. And so, yeah, all of that, they started becoming labels. And it was very tough because I knew that's not who I was. And as I was mentioning about phase two, so it was in high school when I moved to Canada.
Yeah.
I felt as though so here's a little bit of background about Canada, which is phase two of my life, which is also a favorite part about my story. I had not been fitted with hearing aids for the first 16 years of my life.
Yeah.
But when I went to, I know, I don't know how I did it now that I think about it. And then when I saw my family physician, the first visit, she said, "What? You have hearing loss? Well, where are your hearing aids?" And I said, "I don't wear them because I was told I don't need them." And she referred me to an audiologist right away. And my audiologist was like, "Who said that?" It was just like, how? What in the world? And, I just wanted to say that all cultures are very unique and they're different.
Yeah.
I'm not saying that one culture is better than the other. I value the Indian culture that I grew up with. And I think integration of culture has helped me learn a lot about different things. But anyway, going back, then the audiologist first fitted me with hearing aids. My life just changed. I could hear the keys jingle. I could hear the little footsteps and all of those things. I was like, oh my God, this is such a perfect world. Although people with hearing loss will tell you that even with hearing aids, you still have to use lip reading to compensate. It's not at 100%, but it gets you close to it. And then there are other ways to compensate, just as closed captions and lip reading. So now, at this point of my life, I have hearing aids. But internally, I'm still having the ableism. The culture of ableism is still in me. And I am not able to give up that. And I was scared to even come out and identify myself as somebody who has a disability of hearing loss. So I would hide my disability in a situation where, let's say so when I went to college at University of Toronto, and it came to time for accommodations, there were two options. I went to the DRP, and we had a really good accessibility service. And they mentioned that we have two options. One is the FM system, where you go in at the beginning of the class, you give the FM system, the microphone to your professor, they'll wear it, and it'll connect directly to the hearing aid, and the sound quality would be great. And then the second option, more anonymous option, and that is you can have a note taker who can take notes for you. You copy them and you can keep them. And this way you don't give your identity or share that you are disabled. And guess what? Because of that internal ableism, that shame, that embarrassment, and my longing to fit in the culture of being smart students and not having a weakness of disability, I felt that I'm going to go with option number 2.
Well, I think you're not alone in that. So many people, they will forego an accommodation to avoid having that stigma that comes with having an accommodation, whether that's where were you during the test? Why are you getting extra time? There's so much fear there. I think that's a pretty common experience. It's funny because my first thought was somebody else's notes may not be the most effective way for you to learn. I, quite frankly, and this didn't hit me in our multitude of talks that we've had, over the last year or so, it never hit me that you must be brilliant. Like you truly must be brilliant because you have essentially taught yourself. You couldn't hear your instructors as a child. All the noise that comes with being a preteen in middle school, and you still can't hear. You're having to take all of that cognitive energy. Literally, my friend, you are brilliant. You've had to teach yourself. That's resiliency. That's a force of nature right there, honestly.
Lisa, that's really kind of you to say. And thanks for noticing the light in me. It is the brilliance, it is the light that has kept me going forward. And I was mentioning courage, confidence, and also hard work. And this is not just one person. I will tell you, I know so many members in the disability community who are brilliant, who have so much power, who are an amazing individual, but a layer of disability has somehow made them look like, or people are judging them in a wrong way. But people with disabilities are the ones who are problem solvers. They're the ones who are living in a world that is not made for them. And I felt that that has helped me become a better person, a better pharmacist, a better friend, and a parent. I've been at Rush University Medical Center. Great place to be in Chicago.
We love Chicago and Rush.
And I honestly never thought that I would first move from different places that I've been, and then to Chicago. My husband born and raised here, and I felt that, Chicago is cold. I don't know if I want to, initially all of those thoughts, but I love the fact that Chicago is a very diverse city. So being at Rush, 2 months in, I was working as a clinical operations pharmacist. It was very new. And I got this email from this individual called Kevin Irvine. A lot of people know him at Rush. I wouldn't be here without him today, as you mentioned earlier. So I got an email from him, or it was a general email that was sent to every single person who's working at Rush that, hey, we're doing a Disability Employee Resource Group meeting, DERG. And if you self-identify with a disability, or want to learn more about what this group does, please join us. And at that time, I'm telling you, I had not really self-disclosed to a lot of people about my disabilities, maybe very close people at work, but not a lot of people. I was not vocal, I was not open. So I go to this DERG meeting, and I'm at a table with about 15 people. And this is all in person because this is pre-COVID. And we did a round of introduction, and every single person out there is a healthcare professional and is openly, confidently talking about their disability. And my mind was just blown. I was like, no way. For once, I felt I was not alone. For once, I felt I was empowered. For once, I felt that disability is not to be ashamed of, but to be celebrated. It was a life-changing moment. And I'm still crying thinking about it. It's just like somebody showed me the way. And since then, I have embraced my identity gradually, but I have realized the impact because now that I'm openly sharing about, hey, I'm hard of hearing, and that you may need to come a little bit closer when you're talking to me. If I don't hear you, it's not because I'm ignoring you. It's not because I'm lazy.
Yeah.
It's not because I'm rude or weird. It's because I'm hard of hearing. And you know what, Lisa? It created safe space for other people. I had so many people who, had then told me that I have a family member or I myself have ADHD and invisible disability, mental illness. And this creation of that space has really done tremendous cultural shift in our department of pharmacy as well. And I'm happy to talk about it. There's just so much about that support that you mentioned, that somebody has to see that light in you, somebody has to support, and somebody has to lead that way. And instantly, the opportunity is yours.
I love what Kevin has created there. I think he's incredible. I think the whole system of this is a place where people that are in healthcare that have disabilities can thrive. I love everything about it. And he's been such a great support and partner. And when we're running a program or he's running a program, I always try to amplify him and all of the providers that work with him, because what Rush is doing, that is not occurring anywhere else in the country. There is not such a large movement. It's very much the forefront of Rush, and the commitment comes, I know, from the top down. It's just a beautiful place.
You're absolutely right. It's the leaders who are seeing that disability is diversity, that we need to increase representation in the profession in order to serve the population, who have disability. And you're absolutely right. The momentum from whether that is at a DERG, whether it is going to Pride Parade where Rush is representing, disability pride, whether that is at a Invisible Disabilities panel, which I actually was also part of in October 2021. And then also the other aspect of Rush that they've done a good job of is that on their careers website, they've actually showcased different disabilities. And I'm surprised that I actually volunteered to be one of them who openly is saying that I'm the woman with hard of hearing. And then there are other people with invisible or visible disabilities. There have been people who showcase lupus and diabetes and chronic conditions such as cancer. So, it's just an amazing resource to have for people who are looking at Rush. Is Rush doing something about disability inclusion? And the answer is right there.
Yeah. If you're looking for a place to work and that is what you see, that's just not anywhere. With some places, when they talk about disability inclusion, it's a very surface level discussion, right? But I feel like at Rush, it is this deep commitment and this absolute, true, authentic, welcoming space. And I think they found the right person to facilitate that.
In the following section, Dr. Shah goes on to reflect on the supports and challenges that she was met with on the path to becoming a healthcare professional. Follow along as she and Dr. Meeks explore the many critical institutional changes that came about from her drive to advocate not only for herself as an individual with a disability, but also for her patients and the broader healthcare community.
One of the things that I love about my deaf and hard of hearing friends and have noticed across the entire group is that they are the best listeners and they are the best communicators. And it's so opposite of what society believes, right? You are such a empathic, focused, thoughtful listener, and you're such a great communicator when you're communicating things to me. I see you going back and forth with our program manager on some things that we're doing. And I just think, gosh, I could learn from you. It's interesting. I actually think there's a lot to gain from people who are thinking more about the most optimal way to communicate. So you go to college, University of Toronto, and then, like all of us in our 20s, deciding what you want to do. How did you know you wanted to be a pharmacist, and what were your fears about thinking even about going into a health professions degree?
Yeah, that is actually a really interesting question because, as you mentioned, there were times where I felt that even though I had to work hard, even though I was excelling in my grades, because again, I was self teaching a lot of stuff, my GPA, my transcript was great. But when it came to thinking about what career should I choose and would I be a good leader if I can't hear well, how would I listen to the problems? How will I listen to my patients? I knew I wanted to do healthcare, but navigating between whether that was medicine or dentistry, pharmacy, physical therapy, there were so many options out there. And I remember with any profession I choose, being a good listener is one of the biggest things. And I knew that when it comes to listening, for me, it's a focused work. A lot of people can multitask and listen. For me, if I'm listening, I have to drop everything. I'm all ears, but I'm going to drop everything else that I'm doing because it is something that I'm utilizing every part of my brain to be present, which is possibly why people who are deaf or hard of hearing, in some ways, it is that they don't need sound to perceive or to communicate. They perceive through the sound of of love. Not going off topic, but I wanted to say that I was worried about that. I was worried about learning so much material in pharmacy school and then would have to regurgitate everything on an exam. And I knew that I was only hearing part of it. I knew that I had to work hard. So it was definitely challenging, but at the same time, I felt that I have to and I must rise to the challenge of taking on something that I truly want to do. So I felt that that passion was there to make a difference in the community, to be a healthcare professional so I can take care of my patients and provide the pharmaceutical advice. So I think I chose pharmacy because I wanted to make a community direct impact onto patients.
Do you ever think that your experience early on with the healthcare system and the shame that came from that and the effect that came from that was ever part of what led you to be a healthcare provider?
Absolutely. Absolutely. That was one of the other reasons for pursuing healthcare. The fact that I was a patient, being hard of hearing, going into my audiologist from time to time, getting my hearing tested to make sure it's not progressed, getting that very respectful, empathetic care from my audiologist. And also another reason for my healthcare, which is not necessarily related to my disability, but my dad actually passed away while we were in India because of lack of hospitals in the radius where he met with a tragic accident. So I knew that I wanted to be a healthcare professional to save people's life. So I could save somebody else's life and that they wouldn't have to lose a family member. Sorry, getting emotional a little bit, but that was overall push of being in the healthcare. I know it's not an easy profession, and it is a profession or a path that is long and a lot of learning. And in fact, it's a lifelong learning. But I knew that I was in the right profession because I was making a difference.
One of the things that we researchers that are focused on this topic, I know many of them are at Rush as well, we believe that obviously healthcare providers with disabilities are more empathic. We believe that in their service to a patient population, oftentimes these individuals will choose to serve patient populations that are also disabled. In your case, that is true. You don't work necessarily with people with hearing loss, but you do work with people with disabilities. Why don't you tell us a little bit more about your work?
As a clinical operations pharmacist, I work at inpatient psych unit as a clinical pharmacist. And when we're rounding, we're seeing all these patients who are coming to the hospital for a mental illness or diagnosis that is mandating an inpatient admission. And I work with the psych team, and we are seeing people with not only mental illness, then there are obviously different layers of different types of disabilities that can also push people to being severely depressed or suicidal. I have this specific example of this one person. So this is during the pandemic. And I had to advocate for clear mask because for one whole year, we did not have clear mask, and day to day was becoming really tough because, as I said, I lip read and mask became a barrier. So once we finally had clear mask, when I went on rounds or meetings, everyone put on a clear mask. And so physicians, residents, nurses, and social workers, they're all wearing clear masks. And it happened to be that there was a patient who was a young patient and had forgotten their hearing aids at home. And the patient had this, barriers and was not able to hear the care team. And so right away they reached out to me and they said, "Can you please give us clear mask so we can provide access to this patient?" And that was huge. There were so many patients and visitors who then had access to that. But not only that, because of my disability, I've realized that there are alternative ways to provide medical information, even for those who have low vision. To people who have dyslexia, we have to challenge the traditional status quo models and say, let's come up with creative ways so we can partner with our patients. And I felt like the team also looked to me for helping to come up with a creative solution. So that has been really impactful. And having a disability myself, I instantly connected with my patients, whether I'm doing discharge counseling or medrecs. I feel that I connect with patients, even though different types of experiences, but people who, have substance abuse or opioid overdose, even to them, I'm able to connect at a different level. That it's just incredible to see that.
Well, I think that there's something very warm about you, right? There's something that is very, very empathic. And there are obviously lots of situations where patients and people with disabilities would feel vulnerable, but being in an inpatient setting is probably one of the most vulnerable, right? You've lost certain privileges that you navigate the world with, and that can be very frightening. And to feel like you have somebody, I know we've talked about how you talk about the side effects and how is this impacting you, and you care, right? You're helping them find something that works for them and is the least impactful on their joy, their ability to live fully. I know that if I had a family member that was in that situation, I would feel very, very comfortable and really lucky to have you on the team and providing care for them. There's something about you that is just magnificent.
That's really sweet of you. I do think that having a disability sometimes helps to understand that a patient is not a patient because of these diagnoses. We have to understand that their intersectionality, we have to understand that they deserve to have a quality life. And that medical model of disability or any treatment is all about, let's go ahead and treat this. Let's diagnose, treat it. These are the medications that are going to work, and then be done with it. But the connection aspect is so important for the patient to trust the physician, for the patient to trust their pharmacist advice. And I think they should walk away feeling that my pharmacist understands my problems. My pharmacist understands that taking all these medications is not easy, that day in and day out, living with mental health conditions is not easy. So yeah, it means a lot.
So you've done a lot of work around clear masks, and you had that unique experience that I think was so good for the system, for Rush, in that you were both a patient and a provider having the same struggle on both sides of that kind of relationship. And the same thing with captioning. When the pandemic started, captioning was kind of, oh, well, we need to do this for you. Can you talk about how your work and the work of the group helped Rush realize how impactful this could be for everyone?
Yeah. I remember advocating for clear mask felt very isolating. And there were me and a few other individuals in different departments also met through the DERG, also having hearing loss or either profoundly deaf or moderate to severe hearing loss. And we all connected, bonded, and cried over each other's shoulder. I remember, like, this pandemic is is hard on us. We cannot hear our colleagues. We cannot hear our patients. How are we going to provide quality care? How are we going to lower the barriers? How are we going to be at the same leveling playing field? And it took a lot of creativity. It took a lot of emailing, constant emailing to leadership and saying, our life is tough. We need to do something. And so then we came up with actually different possible options. There were 3 different types of clear masks. But the first ones that they came out, they were actually the ones that had a clear window, really good window. Those were the ones that Rush was able to acquire. And it was a huge victory for us. I remember celebrating this moment with Kevin and a few other individuals who I mentioned, saying, yes, we feel valued, we feel respected, that we're cared for. However, this is a different, unique accommodation where this is not something that's given to me to say, here's your clear mask, you can put it on. I actually need other people to wear them in order for me to have access to communication. So now it is requiring other people to feel comfortable, to understand that they are going to have to change their masking practice. And I'll be honest, people were uncomfortable, right? I mean, we're in the pandemic, the mask is not perfect, not comfortable. It took a little bit of time. Cultural shift doesn't happen overnight. And so I remember being in an ironic situation where I'll be the one wearing clear masks because I'm advocating for it, but people are not. And I said, okay, one day, our supervisor, manager, and then director, Erin Shaughnessy, she's very supportive. She believed in me and she kept pushing forward for access for all, equity for all, inclusion for all. And so I remember pushing over time. Then finally, the second set of clear masks came, which was perfect, just like a mask, but it just had a clear window right in the middle, but then it had ear loops. So not going into too much details about masks, but I do remember feeling valued and that there were masks available for patients, for visitors. And then also, Rush has a daycare program for kids of the parents who are coming to work because they have to save lives during the pandemic. This was one daycare that was still open in the midst of the massive shutdown. So then the healthcare providers can go in and take care of people. And so even that daycare, all the teachers started transitioning to clear masks. And within days, they noticed that the children who are between 6 months to 4 years of age were actually responding to a smile. They were more kind. It was amazing to see that they could see their teachers' lip movement and also see that they're smiling. But not only that, they could also see how some of the pronunciation were working because they're learning speech development at the time. So it was just like miracle after miracle with this clear mask. Captioning was the other thing. Initially, we were using a web-based system where we had any meetings or any sort of virtual platform where people will be coming together. We didn't really have captions, or we would have to say, can you please have captions? And then for someone. So I remember being called out in one of the presentations saying, oh, Kruti needs captions. Can we make sure that is on? And so that was that moment. I was like, wow, I'm the only one who needs them. But fast forward 6 months later, because captions were available for all, regardless of any request, this was an amazing part of your universal model that I wanted to share. So many people who are now sometimes working in a busy environment, they cannot tune up their volume, or if they just don't have headphones, they just look at the captions and they can follow along the entire presentation. And I was like, welcome to my world. It's just amazing that universal model benefits so many people, not just the people with disabilities.
I don't think people realized how much they were missing, actually. I think that, one, we have busy brains, right? So our brains are processing little tiny bits of information that fall out in the pathway. So we're not connecting, we're not attending with that rapt attention, right? That you provide. And I think that makes people feel comforted. And then when they see it in the captioning, they're like, well, wait, because what the brain does, if it doesn't hear something and there's a gap, is the brain will fill the gap in with the thing that you are destined to fall into, which is also called your biases, right? The things that you believe. So it's actually, captioning is providing a level of clarity. And I mean, I'm not going to go as far as to say that it's an anti-bias machine, but there is opportunity for bias there. There's opportunity for misinformation, two things that we don't want in healthcare communication.
Yeah.
So I think captioning has really been essential, and it's been a wake-up call to people who didn't really realize that they needed it.
Yeah, agree. You're absolutely right. And it is something that has maybe pushed out or created for people with disabilities and by people with disabilities. But now, as you mentioned, is correcting so many biases within ourselves.
Building upon her lifelong engagement with her experiences with disability, as well as her work as a healthcare provider, Dr. Shah continues to perpetuate cultures of diversity and care for those to follow. Listen or read along as she and Dr. Meeks delve further into her next steps in leadership, as well as her hopes to propel forward the future generations.
So that brings me to kind of what you're doing now. You are doing incredible work. You're going to do some incredible things with us. You're leading a national webinar. You are creating not just disability awareness, but I think you've blossomed into somebody who's saying, oh, there are so many things holding people back. And let's talk about these. And as somebody who's taken that journey, who knows what it feels like to be told to hide something, then to transition to internalizing and hiding, and then to get to a place where it seems almost surreal when you hear the story. Now you're somewhere where it's pride, like not just it's okay to bring my authentic self to work, but I can be proud. And I know that because of my disability, there are things that I am doing, or there are skill sets that I have that are very different and very needed in healthcare. So I don't want to give away all the great stuff you're doing, but tell the audience about all the amazing things that you're doing.
Yeah, thank you. Lisa, you have a way of really bringing out light within people. So thanks for, I feel like when I see myself as a 3-year-old child and then Canada and here, I'm still the same person. Really what has really changed is the perspective, the outlook of viewing the disability internally and externally. And that is transformational. And now I look back and I was like, what was I thinking? But at the same time, it took all of that, and every piece of that was important in forming my identity. So I don't want to change anything. However, because of the fact that I had to deal with ableism, internal ableism, I feel like I find myself advocating more for people with disability because I don't want to have another Kruti in India who's having to hide a disability. Any disability it could be. And so the onus, the responsibility, the time is for me to take action, to shift the thinking about disability, and to show the world that disability is not a weakness, but it is something to be proud of and to celebrate. It's not a choice. Mostly, it's not a choice, but it is something to be proud of because it is beautiful, because we are in it. And so once that understanding came to me, I felt that I was also able to bring my full self to work, and I was able to notice that I was able to bring out among peers. We, as a team of Department of Inpatient Pharmacy at Rush, are truly growing because now we're talking about diversity in terms of culture, diversity in terms of sexual orientation and gender identity. We are talking openly about some of the things that a lot of people in the society have unconscious bias about. And to create that safe space, our department actually just got an award for being very engaged department with the DEI initiative that we have implemented over the last year. Not only that, at Rush, there's this fellowship program called Public Voice Fellowship. I got nominated to be a part of this fellowship and write an op-ed. And so I took the opportunity to raise that voice of disability advocacy and writing that op-ed, which got published in Newsweek. And then also, I am part of this leadership fellowship program called Disability Lead, which Kevin and so many other great people have really shifted the needle in disability advocacy. And together, I felt that I'm standing on the shoulders of people who have made ADA into law, and that now, along with the legal changes, we need to continue to change the culture. And so bringing our full self, bringing and celebrating our disability identity is very, very important. And when you mentioned that I'm the first pharmacist on this podcast, I'm honored, but at the same time, I don't want to be the only one. I know that there are pharmacists out there who have disabilities, but we haven't had the mentorship or the safe space. And together we can create that mentorship and safe space and connection for each other to say, you are not alone.
And I think we're primed to do that. We're going to build out from our women with disabilities in medicine to women with disabilities in pharmacy, and then have you do some interviews on the podcast.
That sounds amazing.
I love it.
So my friend Richa and we're actually working on a YouTube channel, which is going to come out soon. It's going to be Breaking Barriers with RK, R for Richa and K for Kruti. And the reason why both of us thought of this was Richa actually openly shared about postpartum depression and mental illness that she had embraced. It's part of her life. And with my almost invisible disability of hearing loss, but our South Asian community, we want to open up conversations and invite people to hear about our stories and also give them that comfort and confidence. It's okay if you decide not to disclose, but if you decide to disclose, that you're not alone in this journey. So yeah, we're excited about this video YouTube channel that's going to be coming out.
We have a question that we ask at the end of each podcast, and you are our first pharmacist, and we have pharmacy students who may be engaging with us, getting little nuggets and kernels from a multitude of interviews, but they've never had a pharmacist giving this advice. So what advice would you give to a pharmacy student or a potential pharmacy student with a disability who's thinking about entering the profession?
I wanted to say one thing. Don't be scared. You can do it. Seek accommodations. They're there to help you to succeed, set you up for success. Seek mentors. There are mentorship programs for medicine, but there are other ways we will create, and that's in the next 5 years also have mentorship program for students who are seeking careers in pharmacy. There are pharmacists out there who have a similar disability, who may have a similar journey that you can reach out to, but seek mentors. And at the end of the day, write your whys and believe in yourself. Write your whys, look at your whys. That is what keeps me going. There are hard days, but just ask yourself why you want to be a pharmacist. And that will then say disability will not hold you back. It'll actually move you forward.
I have no words after that. It's impossible to add to that, only to say that they were perfect. That's so much light and love.
Hello, everyone. This is Kruti. If you enjoy the Docs with Disabilities podcast like I do, you might also like another one of my favorite podcasts, Research and Resource Round, is a mini cast also from Docs with Disabilities Initiative that helps you keep up with current literature on disability inclusion and education on healthcare. Each episode is 15 minutes or less and discusses one recent article while suggesting additional resources and literature. It's fun, fascinating, and I'm already using the things I learned in my professional life. You can find this research and resource round on the Docs with Disabilities Initiative website or on any major podcast platform.
Thank you, Dr. Shah, for taking the time to share the wisdom you have gained on your journey and ongoing work with disability, and for helping to pave the path forward for the pharmacists to come. To our audience, thank you so much for joining us. If you enjoyed this discussion, be sure to subscribe to our podcast, check out our previous interviews, and tune in again next time. This podcast is a production of the Docs with Disabilities initiative and is supported by a grant from the Robert Wood Johnson Foundation, with additional support from the Stanford Medicine Alliance for Disability Inclusion and Equity, the University of Michigan Medical School Department of Family Medicine and Disability Initiative, and the Ford Foundation. The opinions on this podcast do not necessarily reflect those of the hosts, their respective institutions, or the funders. This podcast is released under Creative Commons Attribution Non-Commercial, Non-Derivative License. This episode was produced by Lisa Meeks and Nicole Kim.